I want you to imagine yourself needing a physical examination. They roughly take, 10-15 minutes? Most jobs require them. But imagine you make that phone call, and then they tell you have to wait 3 months in order to get a physical examination for a new job. I also want you to think about in a time where you need critical care at the ER, and the nurse tells you that, I'm sorry, you have to go to another hospital, there's no doctors there. Now, these may sound drastic and overdramatic, but they're actually going to become reality within the next couple years if we don't start getting our tail in gear with the doctor shortage. Now you may think, does it matter to me? I live in a city where there's a lot of people, a lot of doctors, and it should only affect the rural places, but you're wrong. Because according to Stuart Heisler in a 2019 website, new finding confirmed predictions on physician shortage published by the AAMC, which is the Association of American Medical Colleges. Stuart Heisler says that by the year 2032, the U.S. will see a shortage of at least 122,000 physicians. Now, as a healthcare worker myself, I have firsthand seen the doctor shortage. It's very aggravating sometimes. You have residents or people around the community that need assistance immediately, and they have to travel far distances to get that care, or they have to wait. For an example, working in a rural nursing home, some of the residents need updated prescriptions or just want to talk to the doctor, and they're constantly being told off and on again that they need to wait, or that the doctor will see you as soon as he can, and sometimes it can go on for weeks, if not months. We are facing a mounting problem in America, a mass shortage of doctors. Due to harsh government regulations and restrictions and the work environment of our current healthcare system, doctors are leaving the medical field in pursuit of other careers, all while our elderly population only grows. Now today I'll be discussing why we are facing a doctor shortage, what are the main underlying problems and causes that are causing this shortage in doctors, and first I would like to discuss the main problem we are facing with the doctor shortage. According to Karen Sullivan-Sivert, an anesthesiologist in California, in a 2012 article, The Shortage of Doctors is Worse Than You Think, published on A Pen Point, which is a blog site. Dr. Sivert says that by the year 2025, we could face a shortage of 130,000 physicians, or even more if younger physicians entering the workforce continue to work less and less because of the underlying stress that the environment is creating. Now that's just a bleak outlook of what it could look like in the near future. So I have brought to you a visual representation of what the doctor shortage is looking like. So in 2017, we were short roughly 25,000 doctors. And as you start to look at the graph more and more, you start to see it's just going to keep going up because of the problems we're having currently. And so by the year 2027, they're estimating we'll be short of about 100,000 doctors, which is not good at all. So, according to Stuart Heisler in a 2019 website, Now Finding confirms predictions on physician shortage, published by the AAMC, Stuart Heisler says that the major factor driving the demand for physicians is the growing aging population. In the website, Heisler includes some statistical data to back that claim, stating that according to the U.S. Census Bureau, the nation's population is estimated to grow by more than 10% by 2032, with those over 65 increasing by 48%. That is a very large number. Dr. Lindsay Pratt explains in his book, Where Are the Physicians?, published by iUniverse Inc., how our current healthcare system is not friendly, and that because of this, doctors are either being overworked or stressed to the max, leading them to leave their jobs, and it's also causing a little bit of a disruption in the youth that may have interest in becoming a doctor and now don't. And according to a medical economics staff in the 2018 article, What's Ruining Medicine for Physicians, Government Regulations, published by medical economics staff talked about government regulations being as one of the most underlying reasons for physicians leaving the field. And they also interviewed a bunch of doctors, and one of the main underlying things that they stated is that the problem is government regulations are causing them to have to put more focus on making sure they're following that instead of putting their main focus, which is patient care. According to Dr. Kane, Griever, Kennedy, Sullivan, Wernick, and Baptista, in a 2008 journal, we anticipate physicians shortage meeting the nation's need for physician services, published by APM Perspective, their consensus opinion is that our nation needs to increase the physician supply, while also acknowledging the need to reform our current healthcare system in a way that'll benefit them and will help them help their job role a lot easier. They also collaboratively stated that ignoring the imminent shortage of doctors is putting the nation's healthcare system and the nation's individual citizens at risk. So while these predictions and opinions that these doctors have do sound dire, there is a way that we can come about this and solve this problem. But the motivation to get this right in order to save our country's healthcare system and our doctors is unmeasurable. A priority would be to implement a new policy that would reform our healthcare system in a way that it would provide an increase in support for Medicare and an increase for new residency positions, while also creating it in a sense that would allow some way for the youth our potential new generation to somehow get some kind of interest in the medicine that would drive them to want to pursue the career of a doctor. So with the changes, I strongly believe we will see reductions in the physician staff shortage being projected currently. However, though, it may not fix it altogether, but it will definitely aid in helping the doctor shortage. So I hope that today I've helped you, enlighten you on a problem that's kind of being looked down upon, and I hope that you learned a lot from this. Our current healthcare system is very unfriendly to our doctors and our patients, and is resulting in a massive shortage of doctors. Government regulation and involvement is draining our healthcare system of money and manpower. It's just completely destroying our healthcare system, and they're misusing the whole system overall. We need you. The doctors can only do so much, but if we all come together, we can resolve this issue. If not for you, then do it for your parents, and do it for the underserved portions of our society that cannot get the care they deserve currently or in the near future. Thank you.